Hello, my name is Jessica Johnson, and I'm a fourth-year Doctor of Pharmacy candidate at Florida A&M University. And this presentation is on behalf of Okere et al. On an evaluation of the clinical therapeutic effect of Lixisenatide in type 2 diabetes patients, a systematic review, published in the Journal of Current Diabetes Reviews on July 24, 2017. Type 2 diabetes cases accounts for approximately 90 to 95% of all diabetes cases and is the seventh leading cause of death in the United States. Studies have shown cardiovascular disease to be responsible for about 50% of all deaths of type 2 diabetic patients to date. So it's very important that we have anti-diabetic medications that also have some sort of cardiovascular benefit also. For example, when patients are taking metformin, the risk of cardiovascular mortality is decreased by about 34% when compared to sulfonylureas. This information is great for some patients, but the issue is that some at-risk patients are intolerant to metformin. This has increased the interest in glucagon-like peptide-1 agonists like Lixisenatide, liraglutide, exenatide, and dulaglutide. This interest comes from positive outcomes that have been observed in animal and case control studies. At this time, Victoza and Lixisenatide are the only two GLP-1 receptor agonists with clinical trials showing no increased cardiovascular risk. And this paper discusses the clinical therapeutic effect of Lixisenatide in type 2 diabetic patients. In this study, 13 clinical trials were reviewed. These studies showed benefits using Lixisenatide as an add-on therapy when other oral anti-diabetic medications either were not tolerated or did not lower blood glucose sufficiently. Lixisenatide has the potential to lower A1C, postprandial glucose, and fasting blood glucose without an increase in weight. It also has the lowest potential of gastrointestinal side effects when compared to other GLP-1 agonists. Based on the clinical trials, Okere suggests that Lixisenatide be used as an add-on to insulin-based therapies for patients at risk of increased weight. It can also be used as an adjunctive replacement therapy for dipeptidopeptidase 4 inhibitors. When comparing Victoza, also known as liraglutide, to Lixisenatide, Lixisenatide had a lower proportion of patients to achieve an A1C of less than 7%. Although neither medication showed additional cardiovascular risk, liraglutide did show additional cardiovascular benefits. Lixisenatide can also be used as a replacement for sodium-dependent glucose cotransporter inhibitors for patients with an increased risk of urinary tract infections. In terms of the American College of Endocrinology guidelines, Lixisenatide can be used as an add-on for patients with an A1C greater than 7% or for those patients who need to achieve an A1C of 6.5% or less and are at risk for obesity. Further research will need to be completed to determine the long-term cardiovascular benefits of Lixisenatide. I do hope this video was helpful and increased your interest in the topic. If you have any further questions, please refer to the aforementioned review. Thank you for your time.